Welcome back to Oral Health and Medicine Separate Not Equal. Did you know that in major cities in Minnesota there's about one dentist for every 1,500 people? And to make matters worse, in neighboring counties the ratio can be 1 in more than 5,000. These numbers are alarming, and similar statistics can be found in other rural areas across the country. According to the National Rural Health Association, about 43% of rural Americans lack access to dental care. Furthermore, in many of these communities, even if you're able to find a dentist, it is challenging to get an appointment even with private insurance. However, in rural communities, there are much higher rates of people covered by Medicare and Medicaid, and fewer than half of the nation's dentists accept these patients. This is what the president of the American Dental Association has to say about the barriers that prevent people from going to the dentist and the problems associated with low levels of oral health literacy in rural areas.
What are the barriers that prevent people from going to the dentist? Some are financial, we all agree with that. Some are geographic. Some basically are people are not aware of the need to go to a dentist. Oral health literacy in this country is amazingly low. I had an individual sitting in my chair right here a couple of days ago, and he is now unemployed, and he was telling me that one thing he's really focusing on is doing a lot of preventive maintenance on his car so he can make that car last longer. I look in his mouth and he's got 5 broken teeth. And I said, did you ever think of applying that same concept of preventive maintenance to your mouth? And he looked at me dumbfounded and said, I never thought of it that way.
Over the years, there have and there continues to be many efforts to persuade more dental professionals to move to rural communities, such as counties in Minnesota and West Virginia. One example of these efforts is the Federal National Health Service Corps program, which offers a full year of scholarship support to dentists and doctors who are willing to commit to a minimum of 2 years of full-time service. Some states have also passed legislation authorizing dental therapists, who are mid-level providers, to provide basic dental care and preventative services in areas with a lack of dentists. Although dental therapists could help rural America's oral health crisis, the use of dental therapists remains controversial in many of these areas due to fear of competition. However, there is evidence that more Medicaid patients receive treatment in areas near clinics with dental therapists. This is not a coincidence and is an association that is too often overlooked. While trying to bring more providers to rural areas can help, it will not solve the root problem of rural oral health. The main issue is affordability. People will not go to the dentist if they can't afford it, and adding more dentists won't change many people's minds. In fact, many providers and recent graduates facing up to $250,000 in debt choose not to settle in rural communities. One of the main reasons behind this is because of patients' inability to afford care. This division needs to be discussed more, and oral health literacy in rural and underserved areas needs to be improved before we see any sort of change. Rural Americans are twice as likely to lose their adult teeth as their urban counterparts. This is an alarming statement. Real action needs to be taken at both the state and federal levels in order to even start addressing this oral health crisis.